Hello again, this is Dr. Connor, section 12 of the Stop Fighting Cancer book. Again, there's a lovely little picture of me down there. Notice how I kept it really small. Yeah, there was a purpose in that. We're looking at treating the cause of the cancer, and in this section, we're talking about healing your gut barriers, all your barriers. So, especially with brain cancer, we want to heal your blood-brain barrier as well. But in all cancers, now the difference that we look at in our clinic is that we're not looking solely at, okay, so if a person comes in with liver cancer, we're going to treat that liver cancer. No, we got to treat the person's body. So what causes the liver to function? Well, the brain does. You have to also treat the brain. So in dealing with this, you have to look at different barrier systems. So you have barrier systems in your body. Think of them as walls that protect you. So obvious one is your skin. So you can spill things on your skin and you don't bloat up when you wash the dishes because you have a barrier, this epithelial skin layers that help protect the outside world from the inside world, inside your tissues. Well, so it is with your gut. Your gut is a barrier. Actually, what's inside the lumen of your intestines is in the outside world. What's the inside world is your bloodstream and your gut tissue and your cell structure. So normally you have a lining in your gut that protects from absorbing bad things into your body. So if I had a perfectly healthy gut lining and I swallowed mercury from a mercury thermometer, would that be harmful to me? Well, yes, it would probably damage my gut lining. However, I really shouldn't absorb it. I shouldn't absorb that mercury. The problem is when I have what's called a leaky gut, or professionally we call it intestinal permeability. So when those tight gap junctions of the intestinal cells are separated because of poor diet, genetically modified foods, number one, and chemical exposure, gluten sensitivity, inflammatory foods that we eat that cause this inflammation in the gut and cause damage to these epithelial cells. It causes them to separate out, and things get across into our bloodstream that never should have. That's layman's terms. It's called leaky gut. That causes food intolerances. It causes immune abnormalities. It's a major cause of autoimmune conditions, and there's no way that we want a cancer patient dealing with this at the same time they're trying to heal cancer in their liver. So you have to take a holistic viewpoint when you're going to treat anybody with a named disease. That's part of my little gripe against the current medical profession, is that they take a systems approach, meaning, oh, you have problems with your kidney, well, then you go to the renal specialist. Oh, you have problems with your colon, then we're going to send you to the gastrointestinal specialist. Well, hello, but you are intraconnected. Everything in your body is an intra-relationship. It is not, you cannot separate it out. Though you need a specialist on the GI tract. What controls the GI tract? The brain. Is it controlled by the liver? Yes, it is. Does the kidneys have a function in it? Does the spleen, the heart, etc.? They're all intra-related. So when you just separate them out and look at your body through a microscope, you cannot see this interrelationship that's so important. That's what a holistic point of view is. You need to take a step back and look at this. So it is, even if a person has liver cancer, you want to work on healing these barriers. They're so important. So this picture talks about the gut barrier, but you also have a barrier in your brain called the blood-brain barrier. Very important barrier, because what actually controls the healing of all cells? Your brain does. So your brain is in communication with all these tissues, and that's what stimulates a healing reaction. If you're in a sympathetic dominant state, it's going to be very difficult for you to heal. You can be in a sympathetic dominant state from an inflammatory process that's going on in the brain, decreasing the frontal lobe's ability to communicate, to inhibit deep brain centers that then put this person in a limbic state, and they're dealing with liver cancer. It's going to be very difficult to heal liver cancer when I'm stuck in a sympathetic dominance. So healing the blood-brain barrier and looking at inflammatory markers in the brain are so important. That's why it's very difficult to have a patient and just treat them from an oncological standpoint. You'd have to treat them from a holistic standpoint. You're just going to get better results. So hope this section helps you understand this. So a lot of these things are in addition to the written book, so you're going to get a little bit more benefit out of this little course. So again, if you have questions, call our office. If I'm speaking too fast, listen to it again. Read this section. I hope it's a blessing to you, and I'll see you soon.